Do you have issues breathing, or maybe you snore in your sleep? Millions of people suffer from ear, nose, and throat issues, and will see an ENT this year. Today we're introducing you to Dr. Michael Wolf with ProLions Surgeons Puget Sound ENT. Dr. Wolf, thank you so much for being here.
Thank you for the opportunity. I've been looking forward to this.
Yay! So today we're going to talk with some procedures that you offer to your patients. Yes. First up, starting with a sleep apnea treatment. How does this work? You brought a little demo, I understand.
Yeah, well, it's probably something you've seen a lot on social media lately. It's called the Inspire nerve stimulator implantation. It's actually the nerve helps pull the tongue forward. As we fall asleep, the muscles relax and our throats close, and it blocks our breathing, and then you're unable to get oxygen, and so you lose oxygen, which causes a lot of sleepiness. Probably the number one thing is snoring, very loud, boisterous snoring. Sometimes people are sleeping outside of the bedrooms, and it can be from snoring, which is not very dangerous unless your bed partner wants to smother you with a pillow.
Been there.
But then otherwise, if you get obstructive sleep apnea, that can be very dangerous, and the more severe it is, the more dangerous it can be later on in life, causing heart and lung problems. So treatment is extremely important. And those treatments, the gold standard is the mask that people wear at night called CPAP, or continuous positive airway pressure.
Yes.
And that helps open up the throat. A lot of people, 35%, cannot tolerate that therapy, so we need other things. And
just because they don't like having that on their face?
They feel claustrophobic or anxious, or it's on the face, or the noise of the machine can be a problem. So we have to bring on other things. And when we get to moderate to severe obstructive sleep apnea, more of the beneficial procedures are surgical. And that brings us to this Inspire. It used to be that we'd have to do throat opening procedures, shrink the palate, pull the tongue forward, tonsillectomy. That can be pretty painful, but very beneficial if you need it. Now, though, we have what's called the Inspire hypoglossal nerve stimulator. And this is a nerve stimulator. We put an electrode under the chin on the nerve and tunnel a wire. This gets placed under the collarbone, under the skin, like a pacemaker, and I like to call it a pacemaker for the tongue. You turn it on at night with this handpiece, you turn it on, and then it will turn on, it'll give it a little bit of a time, and then it'll turn on when you fall asleep. And then as you take a breath in, it pulls the tongue forward. It stimulates the nerve and pulls the tongue forward.
This is mind-blowing right now, what you can do.
It's absolutely is changing the game for what we're doing for people who cannot do CPAP therapy.
So who's a good candidate for this? Just anyone that can't handle that, or?
Correct. So it has to be somebody with moderate to severe obstructive sleep apnea.
Okay.
And your sleep doctor will tell you if you're a candidate for that. The BMI or the weight has to be under a certain amount. Usually a BMI, it depends on the insurance. So sometimes it's less than 40 or less than 35. Over 18 years old and intolerant or unable to use the CPAP.
Okay, and many try to avoid surgery as much as possible. So tell us about a non-surgical treatment for thyroid issues and what that recovery is like.
Yeah, I've been doing a lot of thyroid surgeries in my career, and over the past few years we've developed a system called radio frequency ablation, and it's now minimally invasive. We do it in the clinic using an ultrasound. We can guide a probe into the offending thyroid nodule and cauterize it from the inside out.
Whoa.
So it's not general anesthesia. We're not using an incision. People can come in and get it done the same day, go home the same day. Very few restrictions. Can almost get back to their life basically the same day or the next day.
And I want to talk too about chronic runny nose. There's an in-office treatment for that.
Yes, there's several different treatments that use sort of a mechanism to help cauterize or ablate a nerve in the back of the nose, and that nerve is what causes you to have a runny nose. There's a problem called vasomotor rhinitis. This is a big long term that says my nose runs for weird reasons. Eating, cold weather, exertion, and your nose runs excessively. There are medicines that help, but some people fail medicines or don't want to take medicines, and we can use an in-office procedure with an endoscope. We place a little probe in the back, and we freeze or ablate that nerve that causes the chronic runny nose.
Amazing. Where can people find your office for all of these treatments and more?
Well, we have multiple locations. We're in Edmonds. We're also in the First Hill in Seattle, and also in Mill Creek. And we have a group of wonderful surgeons and otolaryngologists that will take care of all of your ENT needs. We can do things like the Clarifix for the nose. We can do the radiofrequency ablation. We are a center of excellence for the Inspire.
Oh, cool.
So we have brought it to the Pacific Northwest, and we're probably one of the busiest groups on the West Coast for doing that.
We're so appreciative of you being here and sharing all of this. My mind is blown. Thank you so much.
Thank you so much. That was wonderful.
For more information on these procedures, just visit seattlethyroid.com that you see right there on your screen.
New Day Northwest is sponsored by Proliant Surgeons Puget Sound ENT.